We have two different protocols for using Biowave. One is a static treatment protocol, and the other is a dynamic protocol. It's actually doing active or passive range of motion during the Biowave treatment. For a static pain treatment protocol, we want to make sure the body, the tissue, is in a taut or slightly stretched position, and then the patient's going to stay in that position for the entire 30-minute duration treatment. Now, in a sports setting, typically we want to do a minimum of 2 treatments. We want to treat before practice of the game, and but what happens is during practice of the game, the athlete may be re-aggravating their particular condition, so we also want to do a second treatment after practice of the game. And the multiple treatments provide a cumulative benefit, much more so than any single treatment. Heat can be used before practice of the game. Ice or cold therapy is very commonly used in combination with Biowave after practice of the game. So that's the typical static pain treatment protocol. In a physical therapy setting, we're talking typically about a single 30-minute session, or in a VA hospital setting, in a pain clinic, as an example, a static 30-minute session would be a single treatment in a day. The dynamic treatment, or we call it neuromodulation during activity, is we want to first place wrap over the electrodes. So we want it could be a cohesive wrap, it could be tape, it could be a Velcro strap. We want to hold the electrodes in place because the patient is going to begin active, or you can do passive range of motion with that patient. So we put tape or wrap around the electrodes to hold them in place. We do a static treatment for 8 minutes. 8 minutes because we want the effect of the electrical field to take place on the C fibers. We want the hyposthesia to kick in on the A delta fibers. That kicks in about 5 minutes into the treatment. We get increased blood flow through the hemisphere where that electrical field takes place. The increased blood flow is a secondary benefit. And so all this is going on during the first 8 minutes of treatment. At the 8-minute mark, we have to reduce the intensity of the treatment to take the edge off the sensation that the patient feels, because we don't want the sensation of the electrical field to limit the ability of the patient to move through the entire range of motion that the physical therapist or athletic trainer wants them to move through. So, for example, if we're treating an upper extremity and the patient in the first 8 minutes gets to 60% intensity on the Biowave device, then at the 8-minute mark, we want the patient to reduce the intensity by 10 percentage points, or hit the minus button and take it down to 50. When you take it down to 50, now when they begin to do their range of motion, say you're treating a shoulder and you want them to do TheraBand work, the patient can move more resistance through a greater range of motion with much less pain. The electrical field is removing the guarding effect associated with pain. So it's facilitating motion. So Biowave is facilitating motion and managing pain simultaneously. It makes it much easier for the patient to accomplish whatever your physical therapy or occupational therapy regimen is for that patient. Because of the long carryover effect with Biowave, there's little post-exercise soreness. So it's a wonderful tool, as I said, to facilitate motion and manage pain simultaneously. So for the physical therapy protocol, we're going to do an example. Let's say the patient has medial knee pain, and then we're going to show what we're going to do to be able to accomplish eccentric quad work during the Biowave treatment. So let's say the pain presents on the medial side of the knee. We're going to place the electrode in this location. We're going to place the dispersive electrode, lateral aspect of the patella, across the patellar tendon. Now, very importantly, we need to place tape or wrap around the electrodes to help hold them in place. First, we want to check the range of motion, so when the patient goes through a complete range of motion, the edges of the electrodes are not going to touch. So we're fine with this orientation of the electrodes. Next, we're going to take some tape and we're going to wrap, if you slide forward a little. We're going to wrap the tape around the electrodes to help hold them in place while the activity is taking place. Okay, you can go back to 90 degrees. Okay. Either connector can attach to either electrode. So the orientation doesn't matter. It can go either way. Either one can plug into either connector. There's no plus or minus or polarity with the electrodes. With this end, the cable, there's a red dot and a notch. They line up facing out. The notch on the cable right here lines up with a keyhole at 12 o'clock in the female part of the connector. If it's not lined up, it won't go in. If it's lined up, it slides in gently and then it clicks in place. To remove the cable, you don't pull on the cord. Do not twist. 2 fingers on the metal barrel and pull very gently straight back, and that releases the cable from the connector. Power buttons on the side of the device. You hold the power button down until the screen lights up. If the screen lights up and it reads 0.0%, you're all set to start. The setup is very fast. So the patient's going to control their intensity, and they're going to increase the intensity so the sensation they feel is as strong as possible but still comfortable. So you're in control. When we hand this to the patient so the cord doesn't stick into their belly, we usually hand it to the patient so the rubber bumper is against their belly, and if they grab the unit here, the thumb naturally falls to the plus button. So you can start increasing the intensity. You're going to ramp it up so the sensation you feel is as strong as possible but still comfortable. If you hold the button down, after 2 seconds it ramps at a steady rate. It doesn't go too fast, but that's an easier way to ramp it up a little bit more quickly. So now the patient's at a strong steady state level. They're going to stay in this static position for 8 minutes. Okay, and during that 8-minute period, we want them to continue to increase the intensity to keep the sensation as strong as possible in the region that we're treating. The body adapts to the electrical field very quickly in the first few minutes of treatment. As the body adapts to the electrical field, the sensation diminishes. As the sensation diminishes, the patient should keep hitting the plus button to keep the sensation as strong as possible. Now, 8 minutes has passed and we're ready to start active or passive range of motion. So we're going to take on a lower extremity, we're going to reduce the intensity by 5 percentage points. So if this was at 21.5, we're going to take it down. Now it reads 16.5. If we were at 60%, we would take it down to 55%. A typical treatment range for the knee is somewhere between 60 and 90%. Okay, so if the patient's at 60, take it down to 55 to take the edge off the sensation. Now we're going to start whatever your physical therapy regimen is. So if the patient comes over here and we want to do eccentric quad work, the cable is 6 feet long. The device can sit on the table. It can sit on the floor next to the patient. And now, if we want the patient to do a lunge, you can do a lunge while this is on, and it's much easier for the patient to get to 90 degrees doing the lunge than without Biowave, because the electrical field is removing the guarding effect associated with pain. Another example of activity during the treatment would be, for example, a passive range of motion. So let's say you have a post-operative knee patient, you're trying to get flexion in the knee. So after 8 minutes of treatment, we take the intensity down by 5% because we're on a lower extremity. So if the patient's at 60% intensity, we take it down to 55. And now you're going to start whatever your treatment regimen is. So if we're trying to get extra flexion in the knee, we can take this and you can push the knee, get an extra 10 degrees of flexion while Biowave is on than without. So the patient's more comfortable, you're accomplishing a little bit greater range of motion, and so it's a great tool to facilitate accomplishing whatever your therapy regimen is. Another example of our physical therapy protocol, say on a foot or ankle, we'll do an example of an ankle sprain, and with the goal of trying to get your patient to do heel lifts, or they could be doing activity on a BAPS board, but for the purpose of this example, we'll show heel lifts. So we've done the placement of the electrodes so that the small pain site electrode, the small rounded electrode is directly over the pain site. The dispersive pad is on the lateral malleolus, which is the comfortable place to receive stimulation. We're going to have the patient go through a range of motion, so do a heel lift, and we can see that those electrodes are not going to touch, so we just want to ensure that that is the case. Then we're going to take some tape and wrap around the electrodes so that we help hold them in place. We've placed cohesive wrap or tape around the electrodes on the foot and ankle to help hold the electrodes in place. We've done a static treatment for 8 minutes. The patient has increased the intensity over that 8-minute period to keep the sensation they feel at as strong a sensation as they can tolerate, but still comfortable. And now at the 8-minute mark, we've just reduced the intensity by 5%, and you could do it as much as 10%. The idea is you want to take the edge off the sensation that the patient feels, so that they can get through the entire range of motion that you want to take them through. So now the device is running, and we've reduced the intensity. And for example, if you want your patient to do heel lifts, the patient can begin doing that activity. So it's so much easier to do a heel lift because the electrical field is removing the guarding effect associated with pain. So the patient can get through that range of motion that you want them to accomplish. You could do this while on a BAPS board. You could, the patient could be riding a bicycle while they're doing the treatment. And so again, it's a treatment that can facilitate motion, whether you're on an upper extremity, working on a shoulder, an elbow, or wrist, hand, or finger, or on a lower extremity like a knee, a foot, or ankle, or you could be doing activity while you're treating the back or neck, certainly as well. For example of our physical therapy protocol, this time on an upper extremity, let's say the patient has medial elbow pain, they're having difficulty getting to full extension. We're going to place the electrodes for the correct treatment. We're going to put them through whatever range of motion they can get through to make sure these electrodes aren't going to touch, which is fine. And now we're going to put wrap or tape around the electrodes to help hold them in place. If you want the patient to do some type of activity, for example, you could provide them a weight and they could do a weight-bearing exercise or a resistance exercise. It's much easier for them to accomplish that exercise because the electrical field here is removing the guarding effect associated with pain. So this is, again, it's a tool to help facilitate motion, and have the patient accomplish whatever your occupational therapy regimen is. Operation of the device is very simple. There's a power button on the side of the device. If you press that down and hold it until the screen lights up, then let go, the device turns on. There's 3 points of connection that we check. We check where the cable plugs into the unit, and right now the display is telling you the cable with an arrow to the unit. The cable needs to be plugged into the unit. There's a red dot and a notch on the end of the metal end of the cable. This notch here mates with a keyhole at 12 o'clock on the female connector. You have to line it up. If it's not lined up, it won't go. Once it slides in, then press the whole thing in and it clicks in place. Now the device is looking for the pads, 2 pads to be plugged into the cable. It doesn't see them, so it's saying 2 pads with an arrow to the cable. On this end, the electrode can be plugged in. The orientation doesn't matter. It can plug in this way. It can plug in this way. You do not need to squeeze the prongs. They just click into place. Either electrode can be plugged into either connector. So you just push, it clicks. It purposely sticks out this far so you've got something to grab onto. So at the end of the treatment, you just grab and pull it apart. It's very simple to use. When these 2 electrodes are plugged in, now is the most important of the 3 error conditions. The unit shows 2 pads with an arrow to the body. If you're all hooked up to the patient and you see this error condition, it means the device does not see the pads on the body. It means the impedance of the skin is too high. So if you did not clean the skin first prior to treatment, then you need to remove the electrodes, clean the skin thoroughly with a damp towel, rub vigorously in the 2 locations that the electrodes are going to be placed. The rubbing action helps to exfoliate the skin, remove oil, lotion, dead skin cells, and what you've done is you've reduced the impedance of the skin. Now you have to also make sure that the electrode is tacky. If it's not, you need to use a new set of electrodes to ensure good conduction through the skin. If you clean the skin and the electrode has good adhesion, then this error condition will go away and the screen will start with 0.0.